Welcome to Medical Link. Now we are discussing about autoimmune hemolytic anemia. This autoimmune hemolytic anemia is caused by autoantibodies that are directed against patient's own red cell antigen. That is, autoimmune hemolytic anemia is caused by autoantibodies directed against patient's own red cell. So here the antibodies are formed against RBC antigen, and this will lead to hemolysis. So the common age group, so it is commonly seen in 20 to 50 years of age, and females are more commonly affected than males. So autoimmune hemolytic anemia is of two types: warm autoimmune hemolytic anemia and cold autoimmune hemolytic anemia. Cold autoimmune hemolytic anemia is further classified into cold agglutinin autoimmune hemolytic anemia and cold hemolysin autoimmune hemolytic anemia. Now, warm autoimmune hemolytic anemia is the most common form of autoimmune hemolytic anemia, and it is caused by IgG antibodies, and these antibodies reacts with RBC at 37 degrees centigrade, and this will result in extravascular hemolysis. Now coming to cold autoimmune hemolytic anemia. Cold autoimmune hemolytic anemia is of two types: cold agglutinin and cold hemolysin. So cold agglutinin is caused by IgM type of antibody, and this antibody reacts with RBC at 4 degrees centigrade. Here the antibody will react with RBC at 4 degrees centigrade, and this will lead to extravascular hemolysis. Whereas cold hemolysin is caused by IgG type of antibody. Cold hemolysin is caused by IgG type of antibody, and this IgG type of antibody is also known as Donath-Landsteiner antibody. Donath-Landsteiner antibody, and this antibody will react with RBC at 4 degrees centigrade, and this will result in intravascular hemolysis. This cold hemolysin is also seen in paroxysmal cold hemoglobinuria. Now we are going to talk about pathogenesis of warm autoimmune hemolytic anemia. Talking about the pathogenesis of warm autoimmune hemolytic anemia. So warm autoimmune hemolytic anemia is caused by IgG antibodies, and these antibodies will react with RBC at 37 degrees centigrade, which will result in extravascular hemolysis. So what happens actually is, this IgG antibody attaches to RBC at 37 degrees centigrade. So IgG antibody will attach to RBC at 37 degrees centigrade. So when IgG antibody attaches to RBC at 37 degrees centigrade, these antibody coated RBC will pass through the spleen. When they pass through the spleen, the Fc portion of antibody RBC complex is recognized by Fc receptor on phagocyte or the macrophage. That is, Fc receptor of macrophage will recognize the Fc portion of antibody RBC complex. So this will cause phagocytosis of RBC in the spleen. This will cause phagocytosis of RBC in spleen. So this will cause phagocytosis of RBC in spleen, which will result in extravascular hemolysis, and this will cause damage to the membrane, which will result in acquired spherocytosis. So they will result in acquired spherocytosis and extravascular hemolysis. So they will show clinical feature of extravascular hemolysis, that is severe jaundice, splenomegaly and hepatomegaly. Now, warm autoimmune hemolytic anemia is most commonly associated with CLL. So warm autoimmune hemolytic anemia is most commonly associated with chronic lymphocytic leukemia, and most common autoimmune disorder associated with warm autoimmune hemolytic anemia is SLE. So SLE is the most common autoimmune disorder associated with warm autoimmune hemolytic anemia. Now, drug responsible for warm type of hemolytic anemia is penicillin and methyl-dopa. So how are they responsible for warm type of autoimmune hemolytic anemia? So pathogenesis of warm autoimmune hemolytic anemia caused due to drugs. These drugs can be antigenic drugs or tolerance breaking drug. So example of antigenic drug is penicillin, which is denoted by P. So when penicillin and RBC is separated, they are not antigenic. When they are separated, when they are independent, they are not antigenic. But once they combine to form a complex of RBC, penicillin, they will act as an antigen. So when they act as an antigen, this antibody will detect it and will destroy it, resulting in extravascular hemolysis. So RBC and penicillin are separate. They will not act as antigen. They will act as antigen only when they combine. So once they combine, the antibody will detect it and they will cause damage and result in extravascular hemolysis. Now coming to tolerance breaking drug. Tolerance breaking drug, the example is methyl-dopa. Let's denote it as M. This methyl-dopa will directly induce the autoantibody in the serum, and this will destroy the RBC, resulting in extravascular hemolysis. So methyl-dopa will directly induce the autoantibodies in the serum, resulting in destruction of the RBC, which will result in extravascular hemolysis. Now we'll talk about cold autoimmune hemolytic anemia. So as we had already discussed, cold autoimmune hemolytic anemia is of two types: cold agglutinin disease and cold hemolysin. So cold agglutinin is caused by IgM type of antibody, and this will react with the RBC at 4 degrees centigrade, whereas cold hemolysin is caused by IgG type of antibody, and this will react with RBC at 4 degrees centigrade. So both are reacting at 4 degrees centigrade. And cold agglutinin disease will cause extravascular hemolysis, whereas cold hemolysin will cause intravascular hemolysis. Now coming to the pathogenesis of cold agglutinin disease. Now we'll talk about cold agglutinin disease. So cold agglutinin disease is caused by IgM type of antibody, which will react with RBC at 4 degrees centigrade, resulting in extravascular hemolysis. So how does this happen? So we'll look at molecular finding. So we'll look at the pathogenesis at molecular level, where IgM antibody, this IgM antibody is directed against I antigen of RBC. So this is an RBC. RBC has I antigen on its surface. So this IgM will be directed against I antigen of the RBC. That is, IgM will bind to I antigen of the RBC at 4 degrees centigrade. And once it binds, this will fix the complement on RBC. So this IgM will fix this complement. So this is IgM and this is C3b, complement 3b, and this is the RBC. So this is the RBC, this is IgM, and this is C3b. So when IgM antibody binds to I antigen of RBC at 4 degrees centigrade, they will fix the complement on RBC, which is a transient reaction. This C3b will act as an opsonin. This will enhance the phagocytosis of RBC in phagocytic system of liver and spleen. So RBC will be destroyed in liver and spleen by the macrophages, and since it is occurring in spleen and liver, it is extra hemolysis. So this will result in extra hemolytic anemia. So we talked about molecular finding. Now we'll talk about clinical findings. So in cold agglutinin disease, there is agglutination of RBC. There is RBC agglutination, and this will result in clump formation of RBC. So this will decrease the blood flow to the distal and distant surface. So once the RBC is agglutinated, and it will form, and this RBC will form a clump. So this will obstruct the blood flow to the distant organ. This will result in ischemia, and it will show a characteristic feature, that is Raynaud's phenomena. And this Raynaud's phenomena, we see pallor, cyanosis and redness, PCR, pallor, cyanosis and redness. Now we are going to talk about cold hemolysin. So cold hemolysin is caused by IgG type of antibody. This IgG type of antibody is also known as Donath-Landsteiner antibody, and this antibody will react with RBC at 4 degrees centigrade. And this cold hemolysin is seen in paroxysmal cold hemoglobinuria, and this will result in intravascular hemolysis. So how does this mechanism occurs? So what is the mechanism? We see IgG antibody, that is Donath-Landsteiner antibody, is directed against P antigen of RBC. In cold agglutinin it was I antigen, whereas in cold hemolysin it is P antigen of RBC. So IgG is directed against P antigen of RBC, that is the IgG antibody will bind to P antigen of RBC at 4 degrees centigrade. So once it binds, the antigen antibody complex on RBC will activate the complement pathway. Now once the complement pathway is activated, large amount of membrane attacking complex is formed. Now this membrane attacking complex will destroy the RBC directly in the blood vessel, which will result in hemolysis, that is intravascular hemolysis. Now we'll talk about the causes of warm antibody. Causes of warm antibody autoimmune hemolytic anemia. So the causes are autoimmune disorder, that is SLE, rheumatoid arthritis, ulcerative colitis, antiphospholipid antibodies. Here the SLE is the most common autoimmune disorder associated with warm antibody autoimmune hemolytic antibody. It is also most commonly associated with CLL, that is chronic lymphocytic leukemia. It can also be caused by Hodgkin's disease, non-Hodgkin's disease, multiple myeloma, thymoma, and drugs like penicillin and methyl-dopa. It can also be caused due to cephalosporin, quinidine, more commonly with penicillin and methyl-dopa. Now causes of cold antibody autoimmune hemolytic anemia. It is most commonly seen in paroxysmal cold hemoglobinuria and infectious mononucleosis, mycoplasma infection. It can be idiopathic and lymphoid neoplasm. Now we'll talk about diagnosis of autoimmune hemolytic anemia. Diagnosis of autoimmune hemolytic anemia. So autoimmune hemolytic anemia is confirmed by Coombs test. There is direct Coombs test and indirect Coombs test, and both direct and indirect Coombs test will be positive for autoimmune hemolytic anemia. So what is direct Coombs test? So direct Coombs test detects the antibodies on the RBC surface, and this direct Coombs test can also be used for autoimmune hemolytic anemia, immunogenic thrombocytopenic purpura, hemolytic disease of the newborn if pediatric serum is used, and mismatched transfusion reaction where patient's RBC will have donor antibody. Indirect Coombs test detects antibodies in the serum, and it is used for hemolytic disease of the newborn in mother's sample. It can also be used for compatibility testing and unexpected antibody like in rare blood group like Kelly, Dove, Bombay blood group, etc. So this was all about autoimmune hemolytic anemia. I hope you understood the concept. I will see you in the next video. Thank you.